You're welcome to HealthAfrik, and this is Meet the Practitioners, a new segment that is dedicated to maternal and childbirth education. Now, in collaboration with the Center for Pregnancy and Childbirth Education, CPACE, this program seeks to bridge the knowledge gap, support decision-making, as well as contribute to a healthier future for families. In this episode, that is the maiden edition, we'll be discussing a common yet often misunderstood condition that affects newborns. I know you wouldn't want to miss this. Stay with us as we go for a quick break. When we come back, I'll introduce the topic as well as our special guest to you. Please stay tuned. You're welcome back from the break. If we just joined, this is Meet the Practitioners on HealthAfrik, a new segment altogether. And today we'll be speaking or talking neonatal jaundice. And we'll look at the causes, the symptoms, as well as how to manage and also prevent complications. Now, joining us from CPACE is Dr. Genevieve Nseidu, who is the Programs Director from CPACE. Hello, Doc.
Hello.
You're welcome to Meet the Practitioners.
Thank you very much.
And I must say, you're looking very, very beautiful.
Thank you.
Great. Before we start, I would like you to briefly tell us more about yourself.
Okay. So, like you mentioned, my name is Genevieve Nseidu. I'm a pediatrician. Okay. That means my interest is in children. Okay. And among the children, my sub-interest is in babies, so neonatology.
Neonatology. Yeah. Welcome once again.
Thank you.
Today we are talking about neonatal jaundice. I know when we say jaundice, it's a liver disease which causes the skin and eye to turn to yellow. Now, with neonatal jaundice, what is it all about and how common is it in neonates?
So when we say a neonate is a baby from the day of birth till 28 days of life. Okay. So that's the first, let's say, month of life. And when we say jaundice, jaundice simply means yellow discoloration. You can see that yellow discoloration on the skin or on the white part of the eye or in the mouth, the lining of the mouth. Anybody can have jaundice, but when jaundice happens in the neonates, then we say neonatal jaundice. Now, it's very common among the babies. So if you take a baby who went through the 9 months of pregnancy and is born, if you take 10 of such babies, 6 of them will get neonatal jaundice.
Wow, 6.
6. If you take the preterms, that's the babies who didn't reach 9 months of pregnancy and for some reason they were born before time. If you take 10 of such babies, 8 of them will be jaundice.
Oh, it keeps increasing.
So it's a very common thing among babies and I think it's good that we'll be discussing it.
It is very good. Yeah. Now, looking at how huge or high the number is comparing like in the number of 10, what are the different types of neonatal jaundice and how does it vary in terms of its severity?
Okay. So when you see a baby who is yellow, you just see the yellow color. Okay. But what is making the baby yellow is a certain pigment in the body which is produced. Everybody produces some. And it's called bilirubin. Okay. Now we have 2 types of that bilirubin. We have the unconjugated form and then we have the conjugated form. Okay. Just looking at the baby, you will not see which one is which. But when we do lab tests, then we know that, okay, this baby is jaundice because it's the unconjugated form that is high or it is the conjugated type that is high. Okay. It's important for us to do this classification because the causes are different and the way we treat them is also different. Yeah.
Now, you mentioning the causes, what are the causes of neonatal jaundice?
Okay. So there are many causes. So if you take the unconjugated type, one of the causes is just simply a difference in the mother and baby's blood group.
Okay.
So a mother who is, let's say, O positive, who bears a child who is A positive, just that difference in the blood group can predispose the baby to having jaundice.
Okay.
Again, when we stick with the blood group, we always say O positive, A positive, or A negative.
Yeah.
That negative or positive is also another type of classification we call rhesus factor.
Okay.
Now, a mother who is negative, who bears a child who is positive in terms of the blood group, that difference also can cause jaundice in the babies.
Okay.
Then there's a condition called G6PD. Its full name is glucose 6-phosphate dehydrogenase deficiency. Now, it's a type of enzyme that is on our red blood cells. So our blood, there are cells in it.
Okay.
The one that actually colors our blood red is called the red cell. Now, there's this enzyme on that red cell that stabilizes it so that if you get into contact with certain medications, your red cells don't break down. If you lack that enzyme, which is a genetic thing, you may be born not having that enzyme. If you have that defect, then simply being given certain medications can cause a baby to be jaundiced. And especially one of the things, things that we use, camphor, naphthalene balls. So some people use it to store in their wardrobes to prevent ants and things. Great. Now, if a baby has G6PD and for the mother, she uses this camphor in storing the baby's clothing or in wrappings.
Okay.
If this baby has G6PD and you wrap that cloth that is stored in with camphor, that will cause the baby to become yellow and actually can be very severe jaundice. So that's for the unconjugated. Sometimes infections can do that. Now, there are other conditions that also cause the conjugated type of bilirubin. And for that one, things like infections again can do that. There's also this condition we call biliary atresia. In such babies, there's certain connections that should be forming in the liver that carries the bile to the gallbladder. They don't have it. When that happens, they become jaundiced, and one of the characteristic things you see is that their stools, babies' stools are usually greenish, then it turns to yellow, gray. But for such babies, their stools are not colored. So it's almost like white or chalky. Oh. Yes. So if you have a baby who is jaundiced and also has that stool not colored, that gives a suggestion for biliary atresia. And for such babies, you need to recognize that jaundice early because they need to have surgery to create some connection for the bile to get into the intestines. If they don't have that surgery as early as possible, way before 2 months is up, that baby will end up with liver failure. So jaundice is just a baby looking yellow, but it's more than a baby being yellow. There's also another condition we call galactosemia. For such babies, if you give them breast milk or any milk that contains lactose, that includes all the formula feeds we have on the market because they are made from cow milk. Those babies can't digest lactose. And for such babies, not being able to digest the lactose also results in them being jaundiced. So for such babies, if we investigate and it's that cause, then that means they can't be on breast milk. They can't also be on the normal formula lactose milk on the market. They have to be on a specialized formula, not banku and fufu. Normal other formulas that are quite expensive. So like I'm going on and on. Jaundice is yellow color, but just looking at the baby yellow, there could be a lot of things happening underneath.
Interesting. This is really, really like I don't know how to even express it. I think it's something we need to focus because you see your kid in that color, probably there's more to it than the yellow skin and yellow eye, and also the color of the stool. Now, how long does jaundice last in newborns, and are there any risk factors aside the causes? Probably a risk factor contributing to its cause. Yeah.
So how long it lasts? So most of the time you find jaundice happening in the first week of life. Most of them would resolve by 2 weeks.
Okay.
If any jaundice is persisting beyond 2 weeks after birth of the baby, we'll consider that as prolonged.
Okay.
And that's for 10 babies. 10 babies means those who reach 9 months of pregnancy before being born. For those who are preterm, that means they didn't reach 9 months of pregnancy. For them, if the jaundice goes on for 3 weeks, then we would say that it's prolonged. Now, the jaundice being prolonged means that there's something that is causing it to persist, and that needs to be investigated, because then there are even other more causes beyond what I talked about that is causing that, and we need to find what it is to be able to manage that. Yeah.
And what are some of the risk factors that prolong it?
Risk factors. Okay. So one is the underlying cause. Sometimes it's hypothyroidism. Sometimes it's infection. Sometimes it's and then in some cases, being born preterm is a risk factor.
Okay.
Some of the jaundice also depend on the cause. It's like that if you haven't treated the cause, it won't resolve. Yeah. Those who tend to have a baby, let's say your first baby was jaundice, your chances of having another baby also being jaundice is high. Yeah, so you look out for that. Babies who are also born very big. So the big baby. So when we say a big baby, it means a baby who is more than 4 kg. Yes. Then they are also at risk of getting jaundice.
Okay, that's the mother. Probably her daily activities also causes a risk of the baby getting jaundice.
No. So
because you made mention of breastfeeding, probably it's something the mother is doing or part of her daily activities that is causing that.
So breastfeeding and jaundice, let's talk about that. So when babies are born, they need to be breastfed.
Yeah.
At least by 30 minutes after birth, they should start feeding. Yeah. Now, for some mothers, they struggle with the breastfeeding. So the babies end up not getting enough breast milk. They get dehydrated. And then the jaundice that would have been simple now becomes severe. Yes. So we call that breastfeeding jaundice. Meaning that the baby is not getting enough of the breast milk. And sometimes it's not because the mother is not trying. It's just because breastfeeding is also a technique that needs to be learned. We think that it's natural, that once you've given birth, you should know how to breastfeed. But it's a skill that especially new mothers have to be taught so that they can attach the babies properly so that they can breastfeed well.
Wow. With the symptoms that you made mention, probably we have to look at more aside the yellowish skin, the yellowish eye, and then the color of the stool. What are some of the symptoms or signs of neonatal jaundice?
So when jaundice starts, it's just a yellow color you see. And for most people, they don't recognize the yellow color because the baby is well, he's feeding, he's crying, he's doing everything the baby does. When you start seeing signs, that then it means that jaundice is becoming severe. And babies don't talk, so it's their actions that will show that the baby is becoming more ill. So one of the things they may do is that they will stop breastfeeding, or they won't be able to feed as they usually would. Good. Then sometimes they become lethargic, they are not as active, they become dull. Then if it goes on further, then they can start having seizures. They can start having difficulty breathing, and then they can die from the jaundice. So when you are seeing such signs, and usually that's what happens. Babies are born culturally, we keep them in the room till like a week plus or 2 before we bring them out. So we don't see the jaundice. By the time the mother is aware, now this healthy baby she took from hospital, everything was fine. Now baby is not sucking, baby is having difficulty breathing, baby is dull. That's when they would move to the hospital, when they should have recognized the jaundice way earlier.
Yeah.
But that's why when a baby is born, it's good to, we keep baby in the house and all that, but at least every morning you should bring the baby out so that in clear daylight, you can see the jaundice. Because if you keep the baby in the room, you won't recognize it. By the time you see signs,
it's too late.
It's late.
So with these signs that you mentioned, which of them should a parent be so concerned that showing it's severe, or probably the early signs aside the yellowish, maybe there's something the baby would be doing at the early stage of the neonatal jaundice?
Babies won't show you any sign. It's the yellow.
Okay.
You have to pick up the yellow.
Okay.
If you see signs, then it's severe.
Okay.
So when I say severe, so the unconjugated bilirubin, the reason why jaundice is unique in the newborns is that in the early stages of life, the first month of life, especially even the first 2 weeks, your brain is very vulnerable. So if the jaundice levels goes very high in the body, it crosses into the brain and damages the brain. Once that happens, that's when you see those signs of babies not sucking, babies lethargic, babies having seizures. That's damage to the brain. No doctor can correct it. Yeah. We can't do much about it. We can only treat the jaundice and bring it to a lower level. So your best bet with neonatal jaundice is that recognize the yellow. And that means bring your baby out in clear morning light to see the yellow. Sometimes babies won't open their eyes for you to see, but their skin, blanch it, put your hand there and take your hand off. You see the yellow color. If you're unsure, come to the hospital and let somebody check for you. Is my baby yellow or not yellow?
Yeah.
But if you want to wait for signs, that's a late sign.
It's maybe too late.
It's late.
Great.
Your baby may survive, but may suffer damage to the brain.
Yeah. Wow, interesting. Now, in your submissions, you keep mentioning bilirubin levels. I'd like you to explain that before we go for break.
Okay. So the jaundice is because your bilirubin level is rising.
Okay.
So what is making you yellow is bilirubin.
Okay.
Yeah. So when you see the baby, one, you can't tell how high the bilirubin is. Then you can't also tell which type is rising. Is it the unconjugated or the conjugated? So that's why we would do a test and then find out which bilirubin, which type, how high, does it need treatment, or there's something, if you continue breastfeeding, it will just wane. Yeah.
Thank you very much. We'll go for a quick break. When we come back, we'll continue with the discussion.
Sure.
Please stay tuned. We'll be right back.
The journey of motherhood is very beautiful. Although it has its challenges, access to quality maternal health care in many parts of Africa still remains a challenge. While many women face uncertainties, others lack access to vital information about pregnancy and childbirth.
This is why we introduce to you Meet the Practitioners on HealthAfrik, a special collaboration between the Association of African Universities AAU and the Center for Pregnancy and Childbirth Education CPES, dedicated to empowering women and their families with essential knowledge about pregnancy, childbirth, and maternal health.
It is heartbreaking to see women in our part of the world struggle because they don't have the requisite knowledge they need to care for themselves and their babies during childbirth. Here at CPES, we believe that every woman should be empowered and supported through her journey through motherhood. That is why, together with the AAU, we are bridging the gap in maternal health care education through the Meet the Practitioners program, ensuring that every woman has the support and resources she needs to have a safe and healthy childbirth.
Join us every Friday at 2:45 p.m. GMT for the Meet the Practitioners on HealthAfrik.
Explore a whole new world of exciting visuals with AAU TV. Get ready for a mix of interesting talk shows, interviews, discovery documentaries, and news on AAU TV. It's not just about watching TV, it's about experiencing something special. AAU TV reaches over 25 countries in Africa, bringing you a blend of knowledge and fun. Learn about different cultures as you enjoy the shows. If you have events or want to showcase your business, we've got you covered. Watch AAU TV free-to-air channel on satellite. Connect with us on Facebook, Instagram, and X, formerly known as Twitter, at AAU TV. Reach out on call or WhatsApp us at +233 26 629 6601 or +233 20 399 5210. AAU TV, the voice of higher education in Africa.
You're welcome back from the break. This is Meet the Practitioners on HealthAfrik. If you just joined, you can follow the discussion on our social media handles at Association of African Universities on Facebook and YouTube. Now, before we went for break, we were discussing the causes of neonatal jaundice. We look at some of the signs, their severity, and also the types of neonatal jaundice. Hello, Doc. Thank you for sticking with us. Sure. Now, before we went for break, just like I was saying, you mentioned the bilirubin levels and the types and when to look at the levels. I would like us to touch more on that. At what point should we come, or a mother come to the hospital to test the bilirubin levels, and what are the methods of testing?
Okay, thank you. So all mothers, when they are going for antenatal, are given a red book. Now, in that red book, for some reason, we don't read it. It's a number of pages, but nobody reads it. Mm-hmm. But there's a page in it that shows signs of an ill baby. Okay. And it's in a circle. Yellow baby is 1. Okay. And the instruction at the bottom is, send your baby immediately you see any of these signs. Mm-hmm. So at any point after you go home after the delivery, even when you're in hospital and you recognize it, you should alert your doctor. Mm. If you have gone home, you should come back immediately. Immediately is immediately to the hospital. Mm. The reason is that you can't tell how severe it is because your baby looks fine, he's feeding and all that. So when you do come to the hospital, the health worker would assess, okay, the jaundice, what level? We'll do the test and know, okay, this level is not high enough that we need to treat. If you continue breastfeeding, it will be fine. Mm-hmm. No, this level we need to treat. Mm-hmm. There are levels of treatment. Okay, so this level, this is what we will do. No, this level, it's really high. We need to do something more. So whenever you recognize a jaundice, please come to the hospital and then let's see.
And with the testing, what are the methods of testing?
Okay, so most of the tests is usually actually blood tests. So we take a sample of baby's blood, send it to the lab to check for the bilirubin. We check the blood group of the baby and then try and look for some of the causes that I talked about. Yeah. Some of those tests can be gotten from the blood. Okay. Sometimes we have to do a urine test for the baby. Sometimes we have to do an ultrasound of the abdomen, all looking for the causes of the jaundice. Okay. But the basic test we'll do is the bilirubin level, which is a blood test.
Interesting. Now, let's talk about the treatments. Currently, what are the available treatments for neonatal jaundice?
Okay. So treatment also depends on the type of jaundice the baby has. Okay. So if the baby has the unconjugated type, we do something we call phototherapy. Okay. So it's a type of blue light, that's a specialized blue light that we put on the baby. We have to take off the baby's clothing except for the diaper and then cover the baby's eye. Right. We put the baby under the lights. The light kind of goes through the skin and transforms that bilirubin into a soluble form for baby to urinate it out of the system. And that will bring the level of the bilirubin down. Another treatment we give is that if the levels are really high, say that we suspect that at any moment it may cross into the brain of the baby, then for that we would have to change the blood of the baby, because the bilirubin is in the blood of the baby.
Okay.
So then the phototherapy takes a while to bring it down.
Okay.
But if the levels are so high, then we have to work quickly to bring the levels down. So we have to go for blood, which matches the baby's own, to take the baby's blood out and give him new blood. We don't do it like, okay, drain off the baby's blood and then give new blood.
Okay.
What we do is you take a little of baby's blood, give the fresh blood you're given, take small of the baby's blood, give like that. So in and out, till by the time we finish giving the whole blood, we've taken out blood, which is actually a mixture of both what we are given but by the time we are done, the levels of the bilirubin will be down. We would have to do labs again to check, and then we continue with the phototherapy. So this is done for the unconjugated type.
Okay.
And then aside that, we have to find what is causing the jaundice and treat it.
Okay.
So if it's an infection, we would give antibiotics to treat. If it is differences in the baby and mother's blood group that is causing what we can't do anything about it. You just know this is my blood group, this is baby's blood group. For the conjugated type, we do not treat that with the phototherapy or the blood exchange treatment. Rather, we need to find what exactly is causing that jaundice and treat it. Okay. So if it's infections, we find what infection it is and treat. If it is biliary atresia, then that one we have to send the baby to the surgeons for baby to have a surgery before baby is 2 months old. Because if that surgery doesn't happen, that baby's liver would fail with time. The liver does a lot of functions for the blood. It produces clotting factors, so that when something cuts you, you don't continue bleeding. But if your liver fails, then you don't form those clotting factors. So you can just bleed spontaneously into your head, into your abdomen. You can just bleed anywhere, and that can kill the babies. Apart from that, other causes like galactosemia, for such, if we also find that is what is causing the conjugated type of bilirubin, then the mother will have to stop breastfeeding. Okay. The mother will have to be given specialized formula that she'll give the babies. Actually, we won't give, we'll prescribe that you buy it because the mother has to buy it. And that's where funds, becomes a problem, because baby would have to stay on those milk. Usually babies are on milk till 6 months before we start introducing
solid food.
Solid food. So if it's galactosemia, yes, she can't continue breastfeeding. She has to stay on those specialized milk. But fortunately, it's not a very common cause of jaundice, but that's how we do our treatment.
Looking at these options for treatment, someone will say they are too, I don't know, it's not going to affect, are there not side effects for such treatments? Looking at the blue light, blood exchange, surgery at that age, what are some of these side effects?
So let's take the phototherapy. It's a very safe method of treatment. The side effects you can think about are, one, because some of the light gives out heat. When baby is under it, he may either get too hot or too cold because you're taking off the clothing. Another thing could be a rash, dermatitis. But those are minor side effects compared to leaving the baby to have damage to his brain, because the brain is his future. If you damage that baby's brain, that's it. Baby can actually even die from the jaundice. So those side effects, skin rash, baby hot or baby cold, is not really weighing the benefits and the side effects. You choose the benefits. If you take the blood exchange one, the risk factor is that you are transfusing somebody's blood. But now blood transfusion is being made very, very safe. Before blood is transfused, it is screened for a number of infections. However, baby can still have a reaction to blood. So again, precautions are taken to prevent that. If it does happen, we have interventions to also treat that. With the surgery, well, surgery is like any other surgery. It comes with its own risks. But now there's surgery for even babies who are in utero. So a baby who is out, who is having surgery, medicine has advanced. It's not like before when you hear operation, like it's a big thing. But now things are different and much safer. Yeah. So don't be too scared.
We thank God. We thank God for that. Also, let's talk about, when treatment, and it comes with cost, it comes with dedication, it comes with time and sacrifice from the mother. Someone will say, I won't do it. You'll be okay. What are some of the consequences for long-term untreated neonatal jaundice?
Okay. So jaundice, majority of them actually can resolve on their own, but you don't know who is who. The severe ones, if it becomes severe and crosses into the brain to damage your brain, the baby's brain. The brain is the baby's future. It's what would help him to walk, talk, do everything. So if he gets damage to his brain, he can end up with cerebral palsy. Cerebral palsy is a condition where your muscles
very weak.
Sometimes it's weak, sometimes the tone is too stiff. You are so stiff you can't move easily. Yes. There's this famous Ghanaian IT entrepreneur. She's called Farida Bedie. If you do have a chance, please read about her. Okay. So she had neonatal jaundice and ended up with cerebral palsy. Okay. She's brilliant. She does whatever she does, even in spite of her disability. But for majority of people, she had great family to support her. Exactly. Majority of people, they don't have that. So the best thing is, if you recognize a jaundice, it's best to prevent that jaundice from becoming severe and damaging the baby's brain. And out there, everybody's trying to reduce injury to babies that can be prevented. So if there's a treatment that can prevent us from getting cerebral palsy, why not? Babies not seeing, baby will grow up and not be able to talk. Those are major things. If it can be prevented by just treating the yellow color, why not? Most times you may not be able to tell who would end up with a severe one and who would not. So the best thing is to come to the hospital and find out which is which. There have been situations where people have stayed at home. It will go. It is just yellow color, whatever. By the time they actually move and get to the hospital, it's late. And some of the babies die. And it's very sad to note a baby who was healthy just dying because he was yellow. Like it's
really sad. It's really sad to know and even experience it. Talking about treatment, maybe a mother or a child, a newborn, will be diagnosed as neonatal jaundice. What advice will you give to the mother or the parents going home and the child being on treatment?
Okay, so if we have to treat, you have to be in hospital because we have to do the treatment in hospital. The thing the mother can do, if you are doing phototherapy, is to make sure that you are breastfeeding your baby as much as possible so that baby is well hydrated. And then it's also so that baby can be full and content to lie under the light because the light is his treatment. A few times, mothers are instructed, your baby needs a photo. Every few minutes, the baby is on the mother breastfeeding. That means the baby is not getting his medicine. His medicine is a phototherapy light. So mother should breastfeed well, put the baby under the phototherapy light, and then allow the light to do the work. If we have to do the exchange transfusion, well, a few times there's a battle with some parents about the blood and all that, but every doctor really wants the best for babies. So we don't, and I'm sure the parent also wants the best for the baby. Just that sometimes there's a misunderstanding.
And probably they're scared.
So, well, try not to be scared. We are all aiming for the goal that the baby becomes well.
And also, before it gets to treatment or the child getting the neonatal jaundice, what advice will you give to parents and new mothers? I know growing up, I saw my mother early in the morning, just like you mentioned, they should bring the child out for them to get the early morning dew and all that. What advice will you give to early mothers and parents and even families and friends to help newborns not getting that kind of disease?
Thanks for bringing that up. I forgot about the sunshine. So the reason I said we should bring the babies out is so that you can see well. If the baby is inside the room, the yellow color is a bit difficult to see in a darker African child. But if you bring out, you see the yellow. That's why I said you should bring the baby out. But there's this notion we've had in the past, which we were actually doing, where baby is yellow, just like we put the baby under the blue light. We also, some people advise I bring the baby and put the baby under the sun. The sun has some of the rays, the UV rays that we use for phototherapy, but it also has other harmful effects, harmful rays, which the baby doesn't need for you to expose him to. Again, the intensity that we need to bring the levels down is not the same as the sun. So there is something in the sun, but the intensity we need to treat is not the same. A few people have ended up taking time, putting the baby in the sun. By the time they actually come to the hospital, things are late.
And what other preventive measures will you
Yes, I forgot about that. So one is that we should all educate ourselves on the jaundice so that we know that yellow color is not just a simple yellow color. The other thing is pregnant women, when they should attend antenatal care. Because when you attend antenatal care, a number of tests are done apart from the education that is given. One of the tests they do is check your blood group. Unfortunately, the fathers don't like coming for the antenatal, so we can't check their blood group. Now, the baby that is going to be born can either take mother's blood group or father's group. If the mother is, let's say, O negative, A negative, that's negative, and the baby inherits the father who is positive, that mother has to get injections, we call them anti-D, is to help prevent the babies from becoming jaundiced when they are born. And it's also actually to prevent the baby from being jaundiced and in utero, as in inside the womb, and to protect the mother against her future pregnancies. Because sometimes if the baby's blood for some reason enters the mother's blood during the pregnancy, it can actually stimulate the mother to recognize the baby as foreign and produce antibodies against the baby. Baby will end up becoming anemic, jaundice in utero. And then the mother now, when she gets pregnant again, those antibodies that are formed would attack the other babies. And mother may not be able to carry a baby to full term. So antenatal care is very important. All the tests we do, there's a reason why we do it. When the baby is also born, please, there are plenty doctors in the house. Do this, don't do that. Yes. Oh, it's a yellow color. Please, yellow is a disease. Bring your baby to the hospital. Some people would say, okay, put breast milk on the baby's eye. It will go. Give baby glucose. It will go. They don't work. Bring the baby to hospital.
Thank you very much. This brings us to the end of today's discussion. Maybe your last words, probably we left something out.
So what I would say is that neonatal jaundice is common. It looks simple yellow, baby is yellow, but it can be very traumatizing for some parents when it becomes very severe. Babies die from the yellow color. Babies get permanently maimed. They can have cerebral palsy. They can have difficulty walking, talking, hearing. They can end up with epilepsy, all kinds of things that they don't need. So if you notice your baby is jaundiced, please get to the hospital and let's talk about it. Thank you.
Thank you very much, Dr. Jeannie, for sharing your insight with us, and we hope to engage with you again on Meet the Practitioners in the next episode. This brings us to the end of today's episode, where we discussed neonatal jaundice with Dr. Genevieve Insedu from CPACE. And just like she mentioned, our fathers, husbands, brothers, please support our mothers when they are going for checkup during their pregnancy stage, and also even after birth. Please support them and be there for them. If you just joined, you can follow the discussions on our social media handles at Association of African Universities on Facebook and YouTube. My name is Isabella Teta Hinakwa. See you again in our next episode. Have a nice day.